Okay, so welcome back to the Men's Hub. Today we're going to be understanding and managing Peyronie's disease. It's a condition that often goes unspoken and more common than you might think, affecting up to 10% of men at some point in their lives. This is a disease that involves the formation of fibrous scar tissue, plaques actually inside the penis, and it can lead to curvature, it can lead to pain, and it can sometimes lead to erectile dysfunction. The condition can impact not just physical health but also self-confidence and intimacy. The good news is it's manageable, so let's explore some of the causes, the symptoms, and both conventional and natural approaches to its treatment. So Peyronie's disease is caused by scar tissue developing in the tunica albuginea, the fibrous sheath surrounding the erectile chambers of the penis, and it leads to curvature or deformity during the erection. It can be painful during sex or during erections, and it can lead to erectile dysfunction in some. And the causes can include micro-injury, so repeated bending or injury during sexual activity, a genetic predisposition where family history of connective tissue disorders like debutans, contracture, or inflammation can often be associated with fibrous plaque formation. And then age, so your chance and the risk of this will increase with age, particularly in men over 40. Now, it's important to note that while mild curvature can be normal, Peyronie's disease involves significant deformity that can impair sexual function or cause distress. Now, the symptoms: curvature. This is a really visible bend or a distortion of an erect penis. You can have palpable plaques, so this is hard lumps under the skin of the penis. There can be pain, especially during erections, but sometimes whenever it's flaccid as well. And there can be a shortening of the penis, and nobody wants that. And that's due to a scar tissue contracting over time. And then erectile dysfunction, such as reduced rigidity caused by the plaques in the penis itself. Now, this can happen gradually or it can appear suddenly, and the severity often dictates the treatment. And the conventional treatment to this is to reduce the pain, improve the curvature, and to restore function. So you might be given medicines such as collagenase inhibitors, Xiaflex, to break down the scar tissue. Anti-inflammatory drugs may manage pain and help with the swelling. Penile traction therapy, so this is stretching devices that gently elongate the penis over time to reduce curvature. Surgery. For severe cases, plaque removal or penile implants may correct deformity and restore functionality. Now, these treatments are most effective when they're started early, so seeking medical advice at the start of Peyronie's disease is crucial. When it comes to natural and functional approaches that are going to be supportive, we would use a herb called Gotu Kola, Tella Asiatica, and the Journal of Ethnopharmacology highlight its role in improving collagen synthesis. It's really helpful at enhancing cognitive tissue repair and reducing scar tissue. Vitamin E is an antioxidant thought to reduce plaque buildup, according to research in the International Journal of Impotence, where it suggests it promotes tissue repair, reducing oxidative stress. PABA, para-aminobenzoic acid, which is found to improve skin elasticity, reduce fibrotic tissue as noted in studies published in urology. Castor oil can sometimes be used as a topical application to soften the plaques and reduce the pain. That's mentioned in Alternative Medicine Review as an anti-inflammatory. There's dietary strategies that include anti-inflammatory foods like berries, turmeric, fatty fish, and you might avoid processed foods such as sugar that can exacerbate inflammation. Physical therapy, so gentle, professionally guided stretching exercises can reduce curvature. Practices like mindfulness and yoga can alleviate emotional stress, which often accompanies Peyronie's disease. There are steps you can take to really manage this. So consult a specialist, incorporate herbal medicines, use traction devices, adopt anti-inflammatory lifestyle and diet, communicate with your partner and stay active. It may be challenging, but it is manageable. And if you combine the treatments with natural and orthodox, there's a really positive outlook to this, and you can regain control and confidence. If you have any other questions, you can visit the Men's Health Hub for more resources and take your first step towards better health today.